Hip dislocations, let's get to that. So most of them are posterior. Don't let your kids grow up to be cowboys, but don't let your kids put their feet on the dashboard and drive. Okay? Because that just puts their hips back to their ears, right? In these front end collisions. And so please keep the knees and hips off the dashboard. You'll see this in falls and jumpers, of course. I see it in my more elderly population who've had a total hip replacement, and then they bend down to do something. They're doing their gardening, they're doing something, and they pop their hip out the back, right? It's a little loose. Every single time I've called orthopedics, because, it's an artificial hip, and I feel like I should give them the first right of refusal. I mean, they did the hip. And ask them if you would like me to give it a shot or would you like to come in. What do they say? Yeah, you give it a shot, and if you can't get it back in, I'll come in, or I'll see them in clinic. No, they'll come in if I couldn't get it back in. Because you can't leave these out, right? There's a neurovascular bundle that's pretty important, unless, of course, you have an artificial hip, and then you can't have avascular necrosis of the femoral head, because they don't have one. All right, but getting it in early is key. There are some really simple techniques to do, and I'll show you how to do them. And any of these techniques, at break time, if you would like me to show you, I'll stick around and I will show you these techniques, okay, one-on-one. But let me show you some of these now. So these are the old ways. These are the ways I don't want you to do it. There's one called the Alice technique. I will show you in the next slide, the Alice technique. This was the first time when I was a first-year orthopedic resident. And I tried to put in this very, very big, strong biker, 300 and something pounds. That's about 150 kilos. Big guy, strong guy, motorcycle guy, popped his hip out, and I tried to put it back in. Oh my goodness, that did not go well. But look at this technique, the Stimson technique, No, yeah, ain't that right, Orange? I ain't going there, because I'm going to end up in HR. Right? It's like, what are you doing back there, doc? Nothing. Just push, bear down. I should have the stink technique or something like that. PU, downwind. I am not doing that, okay? So here's the Alice, and believe me, I had my scrubs on. I had him on the gurney. I got up, and I'm like, and what happened? The center of gravity was pretty high on that bed. Floop. Yeah, and we tossed the bed. Not good when both the patient and the provider go down. It's a lot of paperwork and a lot of explaining to do and stuff like that. So before I knew about these other techniques, when these hips would come in, I would lay the patient on the floor of the emergency department because I couldn't get the bed low enough. So you just put a sheet down, have them sit on it, so I couldn't flip anything, and you do a deadlift. Please don't do that. That's, again, about strength, not about intelligence. I'm a smarter person now than I was when I started 30 years ago. And if I didn't believe teaching and learning couldn't work, I wouldn't be here, right? And I wouldn't sit in on the other lectures because I learn from them. There's always something to learn. And so you can do the Captain Morgan technique. And there are videos on YouTube. I do not do the Captain Morgan technique. The reason they have me doing most of the orthopedic lectures for this conference series is because I've had most of these injuries. And also I think I started in orthopedics, but most of my body, I'm more machine than man now. And this knee just does not work. It just will not get up to that level that I could do the Captain Morgan. But thankfully, there's something called the Whistler technique from Canada. And this is the one I do all the time. Have not had it failed yet. And you have the patient, they're lying down in a supine position with their knees bent to 90 degrees, and then you put one arm under and over to bridge on the kneecap. Okay, and so you form an arm bar. And then you take this hand and put it on the ankle of the affected leg, and you slowly stand up and push down. And this is counter traction, and it pops back in. It is so nice. It was developed in Whistler, Canada, for all the skiers who would pop out their hips on the hill, and the ski patrol would put them back in on the hill using the Whistler technique. Again, at a break, I'm happy to show you how to do these.